everyone. I welcome you once again to the Nurse's Kitchen, and today I'm going to talk about a common condition in the mental health or mental illnesses. The common condition I'm going to talk about is depression. I mentioned depression. I know everybody has heard about depression. One way or the other, we all use the term. And when I'm depressed, it looks like I'm depressed. And today I'm telling you, if you tell yourself that you are depressed, it means that you are mentally not stable, because it's one of the mental health condition, and it is a disease actually. So somebody may ask, what is depression? So depression is a mental health condition which is characterized by persistent depressed mood or loss of interest in activities, and it causes significant impairment in our daily lives. Okay, so when all this term I mean, what do I? Big terms I say, what do I mean? All that I want to say is depression is a mood disorder which is characterized by sadness. So when you are sad for over 2 weeks, you are not able to go to work, you are not able to sleep, you are not able to have your life that you used to have, you are not able to go out, you have deleted your WhatsApp, you've logged out of Facebook, you don't want to have anything to do with social activities, then my brother, my sister, you are breaking down psychologically. And there are so many factors that can lead an individual to suffer this condition. Mind you, I said it's a mood disorder, so there are changes in the person's mood. So the mood, how we feel is affected. So while we are all happy, the individual is sad. While we are laughing, that person is not laughing. He or she doesn't feel about how we feel. So that person, the individual, is not having that edge to feel like how he or she used to feel. And mind you, we have grades or types of depression. I can have a mild depression, I can have a moderate depression, I can have a severe to moderate depression, and I can have major depression. So some of us go through mild depression and we only need therapy. We only need to see a psychologist, and then we are out of this depression. And then when it goes on to moderate depression and you see that it has affected the person's daily activities, then that person will need treatment. And then the severe to major depression, they need treatment, and some we add therapy to it depending on the person's recovery rate. So when you are on medication, don't think that, oh, why this person is depressed and the person is not taking medicine. But I was depressed. I was not put on medication. We are all not the same. We all have different thresholds. Okay, so there are some predisposing factors and that can lead an individual to suffer depression. I have mentioned in my previous videos the predisposing factors of mental illness. They are all the same. For depression, it's all, because it's a mental health condition, the predisposing factors are the same. The most common ones in our society now, as we are seeing, is trauma. Trauma is causing a lot of people to suffer depression. When I say trauma, what do I mean? Trauma by abuse. We have the verbal abuse, the physical abuse, and then the sexual abuse. Most people are going through depression because of these three things. Whilst they were growing up, people in one way or the other abused them, and there's loss of appetite in some cases, and people also have appetite in depression. So it's two ways. Some may not eat, some will also eat very well. So you see them, there's increase in weight, but the person is depressed. And then some also will be hearing voices. Some will also be having delusions. That's where we have the severe or the major depression. So the person will have these changes. He can be staring, murmuring, and because of what he or she is hearing and what he or she wants to respond to or is seeing. So depression can be devastating because the individual going through depression cannot express herself very well. He or she might try to express her feelings, but because most of us don't understand them, we begin to ignore them, use a lot of words on them. Behavior goes out to depression is nutritional imbalance. So when we don't feed our brain well, the brain will be deficient, and it can lead us to suffer mental illness. depression has been one of the common conditions. In fact, anxiety can stress an individual up to also develop mental illness. Observing an accident scene, involving yourself in an accident can also predispose you to suffer depression. So I have mentioned the factors that can predispose us to have depression. So what can you see when an individual is suffering from depression? As I said, it's characterized by persistent sadness. So the person has no interest in all the things that he used to do. When you ask him about him or her about her hobbies, the person says, I don't have any interest. Most people, even TV, they wouldn't like to watch TV. They wouldn't like to go to social media, but that person used to go on social media. He or she has deleted her account. And some people are glued to social media too. So whilst you are in that depressed mood, they do everything on social media just to have a comment, just to have a positive. When you say positive comment, the person absorbs it. When you give a negative comment, the person reacts negatively to it, and that pushes the person to a higher grade. He's withdrawn from friends, withdrawn from social activities. The person will be crying, tearing, things that will not need any cry, any tear. The person will be crying or tearing, and a lot of them get angry often. They are easily irritable. In fact, the little thing you say gets on their nerves, and they also have no sleep. Most of them complain about their sleep. So this is a person who used to sleep around 8 p.m. wakes up around 5 a.m. But here, the person goes to bed around 11 or 12 a.m. wakes up at 2 a.m. He got only 2 hours sleep. And these are the things that will make you know that my loved one is suffering depression. And the depression is treatable. As I said earlier, there are people that we put them on medication, and there are people that we just do therapy for. So many. There are treatments. Anywhere you are in Ghana here, we have community psychiatric units or community psychiatric nurses around all over Ghana. Walk into any government hospital, ask of the CPU or the psychiatric unit, and then you'll be assisted. Also, you can comment if you have any issue, if you have any relatives that is putting up a behavior that you don't understand. Kindly reach out to us. Don't isolate them. Don't stigmatize them. Please, there's help. There's treatment. The person can be treated. The person can recover fully. And the person can go back to whatever he or she was doing. Mental illness is a common condition. And then, as I've been saying, mental illness affects the way we feel, the way we think, and the way we behave. So if I'm behaving weird, know that it's because of an illness that is making me behave like that. Don't stigmatize.